Let's jump into brachioplasties. This entire subspecialty is new to the realm of plastic surgery. And since when did this procedure start to become so popular?
The realm of massive weight loss body contouring began around the year 2000. For us, because I was at the University of Iowa before, and that's kind of where bariatric surgery or weight loss surgery was fathered. And I practiced there, and as a consequence of having all those patients, we developed and pioneered pretty much all the massive weight loss body contouring procedures as a reaction to those folks. Before the year 2000, these patients were isolated to Iowa or right around that area where I practiced. After the year 2000, there was a huge onslaught of bariatric surgery, and there was a great demand for it. So that's when people like ourselves, myself and my ex-partner, we started to teach people how to do these kinds of surgeries, and one of them is brachioplasty. And basically, we had to develop a particular technique that maybe we'll talk about that really addresses the issues in these massive weight loss patients much more than the average patient that you see. Because these patients have a great deal of expansion. If you think of it as a balloon that's been blown up, whether it's in the arms, in the belly, or wherever else, and when you deflate it, it acts like a balloon that's been blown up for a couple of weeks. So instead of coming back and being a small little balloon, it just hangs there. So based on that, the brachioplasty operations for us and for the entire plastic surgery community have become very popular. Before the year 2000, gosh, you could probably go through your entire career and maybe do one or two. Today, most plastic surgeons are doing these, at least once a week, once a month, or something along those lines, and for some even more frequently like us.
Well, I think your balloon example is a really good example for helping people to understand why their skin sags after massive weight loss, and understanding the fact that it's because it's been in that position for such a long time compared to just blowing it up and bringing it down.
Exactly. And I think the other part to understand about that is that every balloon, if you like to think about it, has a certain amount of recoil when you take the air out of it. When that recoil has been interfered with over an extended period of time, the recoil is very little. So a lot of patients come in and say, well, can I exercise it away? Well, skin and fat don't have any muscle in them. So no matter how much you exercise, once you've reached that recoil level, there is no more improvement. And that's where people seek our help.
So Dr. Ali, I would think that a tummy tuck might be the very first thing that a patient inquires about after massive weight loss. Is probably the second, the arms, the brachioplasty?
Yes, the brachioplasty in my practice is probably the second most common thing that we do for these patients. Now, I will say that tummy tucks, on the average, we do much more than tummy tucks for these massive weight loss patients. It's the infrequent massive weight loss patient that we treat with a tummy tuck. We usually do a body lift or a lower body lift or a belt lipectomy for those folks. But that's a more extensive procedure because these patients have a lot more to deal with than just the front, and a tummy tuck only treats the front. But brachioplasty definitely is the second most common, at least in my practice, and then it goes down to a few other areas as well.